Good morning, everyone. I'd like to welcome you to the second day of our conference. We had a really great day yesterday, and today's presentations should be exceptional. I'd first like to introduce Dr. Lance Prince, who's our new Division Chief of Neonatal Developmental Medicine. Dr. Prince came to us from UCSD, where he was previously the head of neonatology. Dr. Prince is an MD, PhD, and his PhD is in cell biology, and his research interests include the molecular and cellular mechanisms controlling lung development and also the problem of bronchopulmonary dysplasia, BPD. He joined us in November of last year and is already advancing our program, and we are so fortunate to have him. Dr. Prince, welcome.
Thank you, Maurice, and good morning and welcome to everyone who's here for the 40th annual MCCPOP Perinatal Potpourri. I'm Lance Prince, and not only am I the division chief, but I have the distinct honor of serving as the Phil Sunshine Professor in Neonatology. And Phil has been a true role model, an inspiration for all of us in the field who have been asking questions about how we can do a better job taking care of moms and babies. And it is really an honor and some very large shoes to fill to have this title. And so I look forward to one day meeting all of you and working with you and collaborating and trying to find ways in which we can advance care in this field. So as Maurice will tell you, we will have a very diverse and outstanding set of speakers today. So thank you for your commitment and for your time. And again, we look forward to working with each and every one of you to find ways that we can collaborate moving forward. So thank you again, Maurice, and I'll pass it back to you.
Thank you, Lance. And again, welcome. Next slide. I just want to point out that the chat function is disabled. Please utilize the Q&A function for each session. Next. Here's how to access speaker presentations. You can read this. You can see any of the speakers' presentations by utilizing this link. Next. Do want to recognize the commercial support that we've received for this conference. Next. In terms of the course evaluation and certificates, here is the way that you can obtain your CME credits. It should not be a big issue. It's pretty straightforward. Just follow the instructions. Next. So today we have a really wonderful program, and we'll begin by just introducing the speakers for the morning session. Our first discussion is going to be about disaster planning. And Dr. Christopher Newton will lead us off. He's an associate professor of surgery at UCSF and director of trauma care at the UCSF Benioff Children's Hospital. He's also the co-PI in a large grant, $3 million from HHS, to develop one of 2 pediatric disaster care centers of excellence in the country. His center is going to be the Western Regional Alliance for Pediatric Emergency Management, and is led by a team at UCF Benioff Children's Hospital. Dr. Ron Cohen will also be participating in this. Among his many, many hats as co-director of MCCPOP, co-director of this program, he's clinical professor and the medical director of the PICN. He has been an absolute leader in pediatric disaster preparedness. In fact, he has invented what's called the TRAIN system, which is an invention that he put together and has now been applied to the obstetrical side as well. Ron is well known to all of you, and he will be giving us his wisdom on disaster planning. Dr. Kay Daniels, a very good friend and dear colleague of mine, is a clinical professor of OBGYN and is co-director of Stanford's obstetrical simulation program. Kay was one of the founders of the OB simulation program, which received national recognition. She's also the co-director of disaster planning for the Johnson Center at Packard Children's Hospital. She does have a number of clinical research interests in obstetrics. And at this point, she is leading efforts on global women's health and bringing simulation and training to underserved communities in low and middle income countries. And Kay is an absolute gem, and we are so pleased that she's here today. Our next speaker after the disaster planning will be Dr. Jair Blumenfeldt, who will be talking about point of care ultrasound in the Nicu. Dr. Blumenfeldt is an associate clinical professor and is triply boarded in pediatrics, pediatric cardiology, as well as neonatal perinatal medicine. In addition to her work on ultrasound and echocardiography, her research interests include studies into bronchopulmonary dysplasia and other areas of interest in pediatric cardiology. And welcome, Dr. Blumenfeldt. The next session is going to be about complex fetal care, the multidisciplinary diagnosis, care, and therapy at Stanford Children's Health. And the theme of this conference is multidisciplinary care. And multidisciplinary care includes collaboration between obstetrics, neonatology, pediatric surgery, ICU. Obviously, every single entity is included in multidisciplinary care. This is one of the themes that Phil established 40 years ago when he developed the MCCPOP program. And Phil, in his inimitable way, was a fierce advocate of collaboration among all the disciplines. And he always emphasized that we all are in this together. This is a team sport. That's Phil's strength. That's his legacy. And we are so grateful to him for making us all realize that we are all in this together. And the end result is that we are looking for great patient care. And babies come from mommies, so we all have to be in this together. Dr. Jair Blumenfeldt and Susan Hintz will be talking to us about this. Dr. Blumenfeldt is an associate professor of OBGYN, maternal fetal medicine. He is a good friend and good colleague of mine. He came to us from Mount Sinai Hospital in New York to complete his fellowship and has stayed on as faculty. He's the director of fetal therapy at Stanford. Fetal therapy is not just fetal surgery, which is the sort of sexy phrase, oh, fetal surgery. It's actually fetal therapy, which includes all types of fetal intervention, and actually fetal surgery is a minor part of fetal intervention therapy, and Jair is going to give us some of his wisdom. He's also the principal investigator on the RAF trial, which is renal anhydramnios fetal therapy trial, which is an NIH-directed trial. Susan Hintz is well known to all of us. She's been at Stanford for a long time, and she is the Robert L. Hess Family Professor and Professor by courtesy of OBGYN at Packard Hospital. She has been a part of Stanford since her undergraduate times. She's director of the Fetal and Pregnancy Health Program, has developed this into a nationally and internationally recognized program, again, of collaboration between neonatology and maternal fetal medicine and every other subspecialty at a children's hospital. She's Associate Chief for Prenatal Services and Associate Chief for Academic Affairs in the Division of Normal and Developmental Medicine. She has also a master's in epidemiology, and she is a prolific investigator and has many publications. Moving on to the session before the midday break is the COVID in maternal fetal dyad. Dr. Gibbs will moderate that session. You met Dr. Gibbs yesterday. He's the Knowles Distinguished Scholar and Clinical Professor of OBGYN. He's an international expert in obstetrical infectious disease and came to us after retiring as chair of OBGYN at the University of Colorado. We were fortunate to grab him in his retirement and put him back to work. And he has done an incredible job for us in putting together an academic program in infectious diseases. He was the lead author of the CMQCC Toolkit, Improving Diagnosis and Treatment of Maternal Sepsis, and has been a major force in the COVID response in OBGYN. Our next speaker is Barney Maldonado. Her formal name is Yvonne, but I don't know anybody who calls her Yvonne, excepting maybe her mother. But Barney, if you haven't heard of Barney Maldonado, you must be on another planet, because she has been a lead international authority on COVID. She has been quoted so many times, I can't imagine. I don't think she ever sleeps, to be honest. She's the Senior Associate Dean, Faculty Development and Diversity, as well as the Tao Professor of Global Health and Infectious Disease, Professor of Pediatrics and of Epidemiology and Population Health. Her research has been focused on epidemiologic aspects of viral vaccine development and prevention of perinatal HIV transmission, but the last year and a half has been consumed with COVID, and Barney has been quoted on almost every aspect of COVID, pertaining to not only pediatrics and obstetrics, but also to adult medicine. And she is a member of multiple task forces in response to the COVID epidemic. Dr. Grace Lee is another speaker in the COVID panel, and she's Professor of Pediatrics at Stanford, Associate Chief Medical Officer for Practice Innovation at Stanford Children's Health. She's a member of the U.S. Advisory Committee on Immunization Practices, very prestigious position, and a member of the COVID-19 Vaccines Work Group, chair of the COVID-19 Vaccine Safety Technical Subgroup. Her scholarly concentrations include informatics, health services, policy research, and prevention research. And last but not least, we'd like to welcome Dr. Christina Hahn from UCLA, where she is the Associate Clinical Professor of Obstetrics and Gynecology, and she's a Division and Fellowship Director of Maternal Fetal Medicine. She currently sits on the COVID-19 Task Force and Education Committee for the Society of Maternal Fetal Medicine. Her scholarly concentrations include preconception optimization of maternal health, as well as advanced prenatal diagnosis, management of complex fetal anomalies, and maternal comorbidities. So without further ado, I'm going to turn the session over to Doctors Cohen, Daniels, Christopher Newton, with Nancy Peterson as a moderator, for No Hospital is an Island, concerning disaster planning. And I think you can see that we've got an incredibly interesting morning ahead of us. So welcome again, and please enjoy the day.